So as you go through perimenopause and menopause, your cortisol levels are going to rise because these cortisol levels during the menopause transition and early postmenopause, let me show you what this research study shows. So your cortisol has a lot to do with your FSH. So here's the thing. During late menopause transition, FSH rises and women experience an increased incidence and severity of hot flashes. If you've heard me talk about perimenopause and menopause, hot flashes happen later in perimenopause. So basically, if you're having hot flashes, your FSH is probably changing. The late menopause transition, known as the late perimenopause, is a period of midlife when women experience mood, sleep, and memory symptoms. Adrenal activation occurs during this menopause transition with a transient rise in DHEAS observed in the SWAN cohort during the late menopause transition, late perimenopause. But the cortisol levels during the menopause transition have not been reported, and that's what this study is talking about. Early lab studies of hot flashes demonstrate a rise in cortisol coinciding with hot flashes measured with sternal skin. Now, when you look at research for hot flashes, the sternal skin area is the most reliable place to measure hot flashes. And the sternal skin, conductance, and temperature. In addition, rising cortisol levels were associated with more severe hot flashes in the earlier report. Now, this doesn't talk about this in this study, but this is why they talk about yoga helping with hot flashes. They say that things like yoga can be helpful because if you can learn to regulate your nervous system, you can have a better chance of fighting off and tolerating your hot flashes. This is why this makes sense. So cortisol levels were associated with more severe hot flashes. And given that 1 in 4 people in the world have a metabolic disease, given the importance of metabolic syndrome and heart disease, it is important to consider that potential relationship with rising cortisol levels during the menopause transition. Women in the late menopause transition, late perimenopause, stage had a higher total cholesterol, greater LDL-C, higher ApoB levels, and greater VLDL cholesterol levels. Thus, changes in cortisol levels across the menopause transition may be associated with increased risk of metabolic syndrome and potentially associated with later development of diabetes and heart disease. And this is why we have belly fat. This visceral fat makes us have insulin resistance. This is why we have this menobelly, because like I've said, we don't broker cortisol as well. We literally don't. You're not being a lazy piece of crap. Your body's transitioning, and I want you to know we can still fight this. We just have to try harder to be normal, and we just have to do more things. And in this study, they go on to say overnight cortisol levels were positively and significantly related to FSH. So the closer you get to menopause, where there is the cessation of your period, 365 days without a period, we know that FSH tells us if you are going into menopause. And the higher your FSH, the more likely your cortisol is squirrely. So it is related to FSH as well as estrone levels. Remember, when we say estrogen, it is a category of estrogens. Estrone is the predominant hormone your body makes when you are menopausal, postmenopausal, when considered as covariates with age. So your ovaries stop making the fancy estrogen, and then your ovaries say, I'm done, and then they tap in your adrenals, which your adrenals also make cortisol, and it's a whole transition of literally one part of your body tapping in another part of your body, and then your body's like, what do I do? What do I do? Now on this channel, I don't talk a lot about testosterone, but the relationship of overnight FSH, estrone, which is your menopause hormone, and testosterone to cortisol levels also reflect the central change in control of circadian rhythms, okay? Circadian rhythms during the menopause transition. Your circadian rhythms is when you wake up, when you go to sleep. This is one thing that I can tell you we can do to help our cortisol is when we wake up in the morning to get outside and get light on our eyes first thing in the morning. I also do grounding. So like I take my dogs outside and I am up at the butt crack of dawn like a farmer. I grew up on a farm. And I am barefoot, putting my feet in the grass, getting light on my eyes. One of the best things you can do that costs nothing. So moral of the story is taken in this information, as your body changes into early perimenopause to late perimenopause to the day I call menopause, 365 days without a period, to postmenopause, this transition not only affects your sex hormones, such as estrogen, it affects your testosterone, it affects your cortisol. So taken together, these findings are consistent with studies of cortisol during the menopause transition and midlife, indicating that cortisol levels rise slightly with age. More often, overnight cortisol levels are associated with overnight urinary FSH, testosterone, and estrogen levels, which is estrone, as well as epinephrine and norepinephrine. Further examination of daytime and nighttime patterns of cortisol is necessary to fully understand the relationship of cortisol and vasomotor and sleep symptoms during menopause transition. Remember, vasomotor is hot sweats and hot flashes and night sweats. The lack of association between social indicators and cortisol levels indicate that, or suggest that overnight cortisol levels do not reflect response to stressors, although they are correlated with other biological indicators of stress response, such as epinephrine and norepinephrine. Dynamic measures such as the cortisol awakening response may be more appropriately used in future stress studies. So they're saying your cortisol going up isn't necessarily your life, it's your hormones shifting. But what you do in your life, such as let's take a breath, meditation, diaphragmatic breathing, yoga once a week, can help us deal with cortisol to the best way we can. Getting light on your eyes helps that circadian rhythm, and getting restful sleep. We want to support your body. We want to support those adrenals, because now they're going to take over the work of your little ovaries that could, because now menopause is ovarian insufficiency, and the adrenals say, I'm up. Welcome to Science of Menopause. Hit the plus sign and follow for more women's health and wellness tips. Bye.